Greetings to all of our dedicated listeners of the Restore Your Health podcast. I'm your host, Laronda, and this week we'll discuss how to recognize the signs of autism in adults and children, the best natural soap for skincare, natural herbs and supplements, updates to COVID 19 and its effects on the heart, and implementing walking into your exercise regimen. Let me state that all content shared on the show is merely for informational and educational purposes only, not meant to cure, treat, diagnose, or prevent any disease. I like to start with a little inspiration. This comes from the quote: If you stay aware of the great mystery that is this life, we will see that we are perfectly placed in exactly the right position to make all the difference in the world. By James Redfield. This quote is so inspiring and truthful at the same time. If you remain patient and become more aware of your surroundings, we will be aware of the great mystery that is this life that we live. Well, you see, nothing will be a secret. In fact, our spiritual discernment will be enlightened as we position ourselves in the place that God has for us. A place where you won't feel threatened or, embarrassed, but embraced, accepted, and loved for the unique person you are. Then you will flourish where you are planted, thus making the difference and changing a world for the betterment of all. I hope this encouraged you. I hope that it inspired you to be more, okay, to be more than what you are right now, and to also be more in tune with your spirit man and discern every moment so you can freely live your life, a life of purpose. Let us go ahead and begin. This week, we're going to begin with the signs of autism, knowing the signs of autism in adults and children. Okay, so first, let's define autism. Autism, also known as ASD, is an umbrella term for neurological development features. Autism is not a disease, but it may have a significant impact on a person's lifestyle and how they view and comprehend and receive information. It varies depending on the person and condition of neural development. Some may need lifelong support, while others can live independently. Also, some cases and conditions may be present in infancy, while others may become more obvious as the individual grows older. Parents may notice a young child has difficulty with some of these sign languages. So let's talk about them. Okay, so in toddlers will not babble by the age of 12 months or produce words by 16 months. Okay, they also will not make eye contact. Toddlers will line up their toys or objects excessively. They also will not respond when people talk to them, but they'll respond to other sounds. So they'll respond to certain sounds, but not necessarily if someone's talking directly to them. Next, they do not want to be cuddled. Okay, so a person who has autism does not want to be hugged or cuddled. Okay, they also do not play with others. They like playing alone. So they may enjoy playing by themselves. And they don't play make believe games like some kids do. Okay, these signs and symptoms for your 3-year old, anyone who's 3 years old and above with autism may have these symptoms. Number one, difficulty starting conversations. Number two, they may use repetitive or atypical language. Number three, they may have difficulty making friends or interacting with others. Number four, they do not like changes to their routine. So don't change up their routines without them knowing. Okay. And the number five, extremely passionate. They're extremely passionate about specific topics or objects. ASD may affect how a person views the world. The individuals may be hypersensitive about some of the stimuli such as light, sound, and taste, leading to the overstimulation of more than one or more senses. Okay, and then which is also known as sensory overload. It can make your everyday tasks like going to the mall very difficult and confusing. So a person with ASD does not want to be in crowds. A person who has that, they feel a little overwhelmed if they're amongst a lot of people. Okay, and then others may also notice that a person with ASD has atypical speech patterns and tones of voice due to late development of speech and speech skills. Due to late development of speech skills, difficulty maintaining and responding to conversations, limited eye contact, and limited response to social interaction, repetitive speech and behavior patterns, and difficulty in understanding other people's feelings and expressing their own. Okay, so these are some of the signs of children with autism. The person may also show repetitive behaviors such as hyperfocus on specific topics like cars and trains, timetables. They may be preoccupied with objects such as toys or household items, all right? Repetitive movements like rocking from side to side. So a person who has autism may experience that rocking from side to side, lining up or arranging toys or objects in an orderly way, and needing to go through a predictable routine each day. A person with autism may experience difficulties with a break in routine, an unexpected event, or exposure to loud, overstimulating environments can be overwhelming. Such situations can lead to outbursts of anger, frustration, sadness, distress, or shutdown that others may interpret as bad behavior. So, these are some of the signs of a person with autism. Their behavior may seem a little strange to those who are not familiar with individuals with autism, and it may look like they have bad behavior, but they're actually overwhelmed by the experience or the environment that they're presently in. Okay, so research Okay, so research shows that 1 in 10 autistic people show signs of Savant syndrome, in which a person has extraordinary abilities in a particular field. This could be playing a musical instrument, calculating complex sums of high speed, or memorizing vast amounts of knowledge. It is important to know that autistic people may also have a higher risk of other conditions such as depression, anxiety, obsession, obsessive compulsive disorder, also known as OCD, gastrointestinal problems, sleep disorders, obesity, high blood pressure, diabetes, and some may even have seizures. The effects of autism on adults is different than it is on kids. So let's go ahead and talk about the effects of autism in adults. Those are the ones we just discussed on children. And so let's talk about autism in adults. So autism in adults. Features of autism may often appear during the early stages of a person's life, possibly by the age of 2 years. However, a person may not recognize those symptoms of autism until later on in life. And sometimes an earlier diagnosis helps a child with ASD get the support during their developmental years that will be beneficial to them in their later years, okay, and throughout life. The features of ASD autism vary from person to person. If an individual has concerns about diagnosis, they may seek the advice of a medical professional. Okay, it's also important to know that there is no one test for autism, but doctors and psychologists may use behavioral assessments, questionnaires, observations, and criteria from diagnostic and statistical manual or mental disorders known as the fifth edition DSM-5 to determine whether ASD is present. They may also need to rule out other possible causes and some behaviors and symptoms in ASD, such as hearing loss. Okay, ASD is a lifelong condition, but with interventions, a person can manage challenges they face, which is so true. Okay, so the earlier you get help, then the better off you will be. But it's never too late. A person with autism, it's never too late to get the help that's needed because the help is out there. Okay, so different therapy approaches can help the speech development with a person with autism, social interaction, epilepsy, depression, OCD. A person who has autism may have some of these symptoms that I'm naming off, okay? They may have problems with their sleep disturbances, interruptions in their sleep patterns, behavior challenges, having a multidisciplinary team comprising of ASD specialists, a caregiver, teachers, speech therapists, and psychologists can work together with the individual and their parents to provide the support needed for a successful management of ASD. People with ASD need varying levels of support. Autistic people may behave in ways that appear strange to others. However, it's a means of helping them cope with circumstances when they feel overwhelmed. Okay, so these behaviors may be ways for a person to protect themselves from an um, environmental things that feel overwhelming. It helps them to manage their emotions and establish a sense of order. Neurotypical people may not understand these reactions, which may lead to the individual feeling isolated and distressed. Parents, caregivers, and others can maximize a child's quality of life by learning about ASD and providing support. For instance, they can help by learning how ASD affects the child, accepting that while an autistic person may be different than the neurotypical person, they are still a complete person with their own strengths and weaknesses. Being consistent in routines and rules, building on the child's strength and interests, researching and building up a support network, following routines where possible, planning and preparing for changes in advance. Okay, so no surprises, avoiding overstimulating environments where possible, or introducing them gradually, encouraging cooperative behavior by setting limits and offering choices, listening to autistic people who speak and write about their experiences. Okay, so those are some ways that you can help. They can also work with the child to find out what triggers the reaction, what reactions are likely to occur, okay, and when, and what they enjoy and what they do not enjoy. So, what they enjoy and what they dislike, how they best communicate. And you can learn about how they best communicate, how they prefer to learn, and what their strengths and weaknesses are. If you suspect your child may have ASD, seek the advice of a medical specialist. Okay, we have references here on the CDC. You can reach out on their website at www.cdc.gov/ncb/autism/index.html. And we'll also have this posted so that you can click on the link and go directly to the website. For autism spectrum disorder fact sheets, you can visit www.nih.gov/autism-spectrum-disorder-fact-sheets. Now, I know that was a lot, but that's their website. And again, we will have this posted on our broadcast so you can easily click on the link and go directly to their website for those resources. Okay. All right. So next, we're going to talk about natural soap and skincare. Who doesn't want glowing skin? Who doesn't want good skin? We all do, right? Our skin can go through changes as we get older, depending on the environment and the conditions of the individual's overall health. Did you know that skin protects you from potentially harmful factors? That's right. Everything on the human body has a rhyme and a reason for existence. While health and beauty companies produce soaps designed to manage varying skin conditions like acne and sensitive skin, nothing works to manage your skin better than natural soaps can. Vegan soaps like charcoal soap, lavender soap, lemon soap, cocoa butter soap, shea soaps, and Indian hemp soaps are made to help the most sensitive skin types. So these soaps are formulated for sensitive skin types, okay? And although we have some antibacterial soaps that are helpful in managing acne, the natural soaps are suggested and they help you to maintain a glowing and healthy skin. So the charcoal bar soap is made with powerful skin cleansing agents. Its moisturizing ingredients like orange blossom, essential oil blend for clean, moisturized, and fresh smelling skin. This naturally derived formula is also beneficial as a facial soap for combination and oily skin types. Okay, it helps maintain clear, healthy looking skin. All right, so next we'll talk about the Valor. The Valor Moisturizing Soap is for gentle cleansing without over drying your skin, and it contains naturally derived ingredients with an exclusive blend of premium essential ingredients. The Valor Moisturizing Soap is infused with an exclusive blend of black spruce, blue tansy, geranium, and frankincense premium essential oils for a grounding, empowering aroma. Triple milled to ensure a long lasting bar with rich, luxurious lather. Its moisturizing formula, it's gentle on your skin and it's gentle cleansing without stripping your skin of the natural moisture barrier. It leaves your skin feeling fresh, clean, and soft. Okay, and it's gentle enough for all skin types. Okay, so that's the best information there. And then we also have the Mary Kay Sealed Cleansing Bar Soap for normal to combination skin, and the Time Wise 3-in-1 Cleansing Bar for acne prone skin and all skin types. These soaps will help you maintain a healthy, vibrant skin. You can purchase all of these products on my website. And let me just state that these two soaps are from different distributors. So you have the Mary Kay soap that offers the sealed cleansing bar soap, the combination of the Time Wise and the acne prone, and then the Young Living of the Valor and the charcoal, more natural bar soaps. Okay. So if you need those, you can get those off of our website, and we'll have everything at the bottom at the end of our broadcast for you. Okay. So next, we'll discuss implementing walking into your regimen. That's right. Let's get to moving. We all know that exercise plays a vital role in our health and well-being of the body because our bodies were meant to be in motion. Finding an exercise regimen that works for you is very important. Okay. Walking is one of the best exercises. Let me tell you. Walking is good for people of all ages, okay? And that's just mainly because walking helps you to move just about every muscle in the human body without putting strain on your body, okay? You can walk 15 minutes a day at least 5 days a week, okay, and get your exercise in. It helps you to lower your blood cholesterol. It helps you to lower your blood pressure. It helps with heart health, and it also helps to improve other health conditions. You can walk any time of the day, morning, evening, or during your lunch break. You can even walk at night, okay? So many people set their exercise regimen according to their work schedules. It's up to you. So you know what time is best for you. Set your schedules, okay? Go ahead and set your calendars and start your walking regimen. Get to walking. Let's get the body in motion. Look, we've had some really good weather out here. Lately, the sun's been shining. We have beautiful weather. Spring is in the air. Spring is here. We're right in the middle of spring, or at the beginning of spring, shall I say. And the weather is beautiful outside. So it's beautiful enough for you to get out and start your walking regimen. What better time than now? Okay. All right, so let's talk about let's switch up a little bit and talk about COVID-19 and its possible effects on the heart. Let's get some updates on COVID. The question is, can SARS-CoV-2 cause arrhythmia? Recently, in an article with Medical News Today, researchers found a distinct resemblance with COVID-19 and the heart. That's right. SARS-CoV-2 can infect the heart pacemaker cells, causing rhythm problems due to the virus that causes COVID-19 infection of the cells, also known as the pacemaker cells, and comprise of the sinoatrial node, the sinus node. Okay, and can result in irregular heartbeat, causing tachycardia or bradycardia, which is the speeding up or the slowing down of the heart rhythm. A study exploring the link with SARS-CoV-2 and heart arrhythmia found that information shedding a new light on the effects. So the research reported in the journal Circulation Research explores recent findings that heart abnormalities are a common symptom of COVID-19, and it could be a consequence of SARS-CoV-2 affecting the specialized pacemaker cells of the heart. Yes. So this research was carried out by a team from Weill Cornell Medicine in New York City, which included Shubing Chen, PhD, Associate Professor of Surgery, Chemical Biology, and Biochemistry, Robert Schultz, MD and PhD, Assistant Professor of Medicine, and Todd Evans, PhD, Professor and Vice Chair for Research, in addition to Benjamin Tenover, PhD, a faculty member at the Grossman School of Medicine in New York, Langham Health, and New York University. It has been almost 17%, okay, of hospitalizations, individuals with COVID-19 experience heart irregularities. Okay, so this report shows that a 17% of people who were hospitalized showed symptoms of heart um, arrhythmia problems. Okay, the electrocardiogram trusted source (EKG) studies trusted source of COVID-19. Patients have described tachycardia as one of the most observed abnormalities. Additionally, studies have observed that 56% from a trusted source of hospitalized COVID-19 patients with a fever also present with bradycardia. Wow. So increasing evidence suggests that SARS-CoV-2 can infect a specialized heart cell called the pacemaker cells. This is also from the trusted source. Once the pacemaker cells become infected with SARS-CoV-2, the self-destructive process of ferroptosis, trusted source, which is an iron-dependent cell death that begins within the sinus node. Okay, it's the heart's primary pacemaker, and damages to its structure causes bradycardia or a heart rate to slow down. So remember, bradycardia is when the heart slows down and the heart rhythm, slows down. Okay, so the node controls cardiac rate and rhythm as part of the heart's conductive system. However, few reports have documented whether the sinus nodes could become infected with SARS-CoV-2 in individuals with COVID-19. The team from Weill Cornell Medicine used a type of pluripotent stem cell, okay, from a trusted cells, which is also the HP, also known as the HPSC, called human embryonic stem cells, which is the HESCs, okay, to derive human sinus node-like pacemaker cells. The researchers also observed Syrian golden hamsters, which is the Mesocricetus auratus, okay, as they are susceptible to SARS-CoV-2 infection following a nasal exposure to SARS-CoV-2. The researchers noted that their cardiac pacemaker cells were infected. Wow. So according to the study, authors at 12 months post-COVID-19, okay, post-COVID-19 people continue to have an increased risk of cardiovascular disease spanning several categories, including cerebrovascular disorders, dysrhythmia, and ischemic and non-ischemic heart disease, pericarditis and myocarditis, heart failure, and thromboembolic disease. So those um, people infected with SARS-CoV-2, COVID-19, will have some of those symptoms, okay, and some of those disorders. Says what is more, they write that the risks were evident regardless of their age, their race, sex, and other cardiovascular risk factors, including obesity, hypertension, diabetes, chronic kidney disease, and hyperlipidemia. So, saying all that to say, it doesn't matter your age or what condition your health is in. Those who have been affected by SARS-CoV-2 all have the same symptoms, according to this study. Okay, they were also evident in people without any cardiovascular disease history before exposure to COVID-19. There's been talk about a new variant, the XE. Okay, so let's talk about that. There's been talk about the new variant that's coming or that's already here. It's called the XE. It's a combination of the Omicron variant BA1 and BA2. The XE variant has a significant difference in transmission and disease characteristics, including severity according to the World Health Organization, WHO, the latest epidemiology report published on March 29th. The XE has similar symptoms, symptoms like a fever, a sore throat, scratchy throat, cough, cold, skin irritation, discoloration, and gastrointestinal trouble. Estimates indicate community growth rates of about 10% as compared to the BA2. It appears to be more transmissible than other strands of the coronavirus. Wow. So, however, who is still carrying out their study on the transmissibility of COVID, the new XE variant. So, it's still under research. Scientists are researching how it affects fully vaccinated people against the new XE strand and how it could provide more protection against the new variant. Even if COVID-19 vaccinations don't provide complete protection, it will minimize severe disease, keeping hospitalizations and mortality at a minimum. According to WHO, people must continue to follow safety precautions. So, I know we thought we were out of the woods with COVID, but it looks like because we have the new XE strand that we're going to have to put those masks back on. All right, so wear a properly fitted mask. Wash your hands, keep your hands clean frequently, And you can use an alcohol-based hand rub or soap and water. You can unlock your windows to enhance ventilation. Open your windows, let some fresh air in, or open a door and let some fresh air into your space. Self-isolate if you test positive for COVID or develop any of these symptoms. You can also use our natural hand sanitizer if you want to use that as in alternative to the alcohol-based hand sanitizer or hand soap. Okay, so I know, like I said, I thought, a lot of us thought we were out of the woods with COVID, but because the new variant XE is here, um, we need to take these safety precautions. Follow the safety precautions to keep the spread down, okay? We're going into the holiday weekend and we don't want anyone to get sick, okay? To stay up to date with COVID-19, tune in to our weekly broadcast at the Restore Your Health podcast with Laronda Dawson to find out how the body can naturally heal itself with the help of natural plants and herbs. Purchase my new ebook, Live, Sleep, and Eat Well on Amazon and at larondadawsonministries.com. Your Young Living health and wellness supplements can be purchased at myyl.com /Laronda-Dawson. And you can get that vegan and antibacterial soap on the website as well. If you want to get the vegan soap, or if you want to get the MK antibacterial hand soap or facial soap or bar soap, you can get those at larondadawsonministries.com. All right, you're going to go ahead and click on shop. And then once you click on shop, you can find the products that you need there. Okay, and there's also a link to these different distributors on our website. Okay, so you can also click under that as well. Okay, also you can connect with us on social media on our Facebook page. Okay, our Facebook page is Restoring Health Nationwide. You can also connect with us on Twitter at Laronda Dawson at Dawson Laronda. Well, that concludes our broadcast of the Restore Your Health podcast. If you like this video, click the subscribe button and share it with a friend. Until next week, have an amazing weekend and happy Resurrection Sunday. Have an amazing weekend, everyone.